A new study suggesting that women who have heart disease may have a greater risk of developing aggressive breast cancer. Researchers looking at data from more than 19,000 patients finding women with locally advanced or metastatic breast cancer were 10% more likely to have pre-existing heart disease compared to patients whose diagnosis was at stage 1 or stage 2. Joining us to talk about that and other health topics, Dr. Bill Hartman, clinical trialist at UW Health. Good afternoon.
Thank you.
It's becoming more in the public consciousness that heart disease is the #1 killer of women. And now we're learning that it can also have these other consequences, cancer.
And I think that that's really important. And it's an association that's been speculated a long time that there was some sort of relationship between heart disease and breast cancer. These are both really large killers of women and major causes of death in the United States. And so researchers looked at these 19,000 women that were diagnosed with invasive breast cancer between the years of 2009 and 2020. And what they found was pretty astounding, that 50% of these women with invasive breast cancer also had heart disease. And it's hard to say exactly what this means, but in terms of treatment, that is, but maybe in terms of screening, women who have a history of heart disease or at least a family history of heart disease should talk to their doctor about getting earlier or more frequent breast cancer screenings.
So we don't know of a causal relationship, but we do know that this may make some changes in the screenings for breast cancer.
That's correct. And that's a big step along the way. We're always looking for factors that might predict things down the road. And if heart disease has this 50% association with these invasive breast cancers, then certainly women with like I said, with a history of heart disease, or at least a family history of heart disease, may require earlier or more frequent screenings.
I came up with the generation that I think saw the beginning of labeling on cigarettes that could be harmful to your health, can cause cancer. And now, decades later, we're talking about the same kind of warning for alcohol.
The Surgeon General came out this week suggesting that alcohol should have warnings, that there may be some association between alcohol and cancer, and that alcohol can actually cause certain types of cancer. And because of this, and because this association has been around for a long time, and this relationship has been really suspected for a long time, the Surgeon General feels that bottles of alcohol should have a warning so that people know when they're putting this into their body that there is a chance down the road that alcohol can cause and lead to these various types of cancer.
All right, quickly, what's the best diet? Asking for a friend.
The gold standard continues to be the Mediterranean diet, focused on berries, fruits, grains, less on ultra-processed foods, less on red meats, more on fish. This tends to be the diet that gets talked about the most. And once again, the experts have said that this is the best diet for you to maintain good health going forward.
Dr. Hartman, I'm trying to give up ultra-processed foods. That's my goal this year. And I'm looking, at the label. So pizzas, frozen pizzas, I had to put them away.
Put them back in the back part of your freezer. Yeah. Bring the nuts and the fruits forward.
All right, Dr. Hartman, thanks so much.
Thank you.